By Alexandra Olson. Associated Press. Americans went to the polls Tuesday under the shadow of a resurging pandemic, with an alarming increase in cases nationwide and the number of people hospitalized with COVID-19 reaching record highs in a growing number of states. While daily infections were rising in all but 3 states, the surge was most pronounced in the Midwest and Southwest. Missouri, Oklahoma, Iowa, Indiana, Nebraska, North Dakota, and New Mexico all reported record-high hospitalizations this week. Nebraska's largest hospitals started limiting elective surgeries and looked to bring in nurses from other states to cope with the surge. Hospital officials in Iowa and Missouri warned bed capacity could soon be overwhelmed. The resurgence loomed over candidates and voters, fearful of both the virus itself and the economic toll of any new shutdowns to control its spread. The debate over how far to take economically costly measures has divided a country already sharply polarized over President Donald Trump's turbulent 4 years in office. The pandemic colored who voters chose at the ballot box and how they did it. While many Americans took advantage of expanded access to mail-in voting, lines were long in many polling places, with record turnout expected and reminders of the pandemic everywhere. It's very serious that we have 400 people gathered in one space at the height of the pandemic here in Wisconsin. So, we've tried to take every measure to limit the movement throughout the room, said Claire Woodall-Vogg, the Election Commission Director of the city of Milwaukee, where poll workers were spread out into 12 different pods to limit contact. Hand sanitizer on voters' hands caused a ballot scanner to jam at a polling place in Des Moines, Iowa, Secretary of State spokesman Kevin Hall said. Hall said some voters' hands were moist when they handled the ballots and the buildup of sanitizer eventually caused the scanner to stop working. The machine was fixed in about an hour. Meanwhile, Iowa hospital officials warned their facilities and staff could be overwhelmed without serious efforts to curtail the virus spread. The state's 7-day rolling average of positive cases reached 36.4% over the weekend, the third highest in the nation behind South Dakota and Wyoming, according to researchers at Johns Hopkins University. Hospitalizations reached a record 730 on Monday. Suresh Gunasekaran, CEO of University of Iowa Hospitals and Clinics, said Iowa is entering its third peak, one that is higher than previous ones in May and July. He said his biggest concern is that this peak comes at the beginning of the cold weather season, when the flu and other respiratory conditions typically increase hospitalizations. The infection rate is definitely a leading indicator for hospitalizations, and the hospitalization rate is a leading indicator of mortality, Gunasekaran said.